I'm Dr. John Kruse, and today I'm going to be talking about mantras for anxiety. Mantra comes from the Sanskrit word, or two words combined, meaning man, meaning mind, and tra, translated by some as vehicle or tool. So mantras were devised by the Hindus as a tool for getting into your mind and calming your mind, and their belief system believes that the mantra exists at a certain vibration, and it's fundamental vibrations that penetrate your mind, brain, mind, soul. I don't know how we want to define that, and that have some calming significance for the individual and uniting significance to a greater, higher power, gods. Certainly mantras, even though that term itself is, again, Sanskrit and tied to Hinduism, mantras are used in a variety of traditions, particularly religious traditions. So there's certainly Muslim people who chanting Allahu Akbar, and if I'm horribly mispronouncing things, forgive me. There's certainly Catholic and other Christian traditions who are citing the rosary over and over, or other religious sayings. There's certainly Hebrew phrases or sayings or songs that are also used in a repetitive way to help calm someone and unite them to some power or strength. Mantras in the sort of modern therapeutic armamentarium are fairly new. And there has been a body of research looking at, as Herbert Benson called it, the relaxation response. So there's been a research into meditation and other aspects of particularly Hindu traditions and beliefs tied in with mantras and meditation since the 70s, showing physiologic benefits. But in terms of specifically using mantras for treatment, I'm not aware of much before a study got published in 2018. And that was a study specifically looking at mantra therapy. They call it mantram therapy to treat PTSD. And this was done by a large consortium of researchers at a couple different VA centers in America. Anyway, the preeminent researchers on PTSD and post-traumatic stress disorder are the VA centers, because they're dealing with so many veterans who have seen atrocities, often committed and acted in violent ways, often resulting in death, dismemberment, horrible events, which can have traumatic effects on humans' brains and behavior in a multitude of ways. For the last few decades, although medications can be helpful if there's depressive elements or anxiety elements, we do not yet have any simple, or even for the nightmares, prazosin, blood pressure medicine, has been effective in some, but not all studies for nightmares associated with PTSD. So the current understanding for medication approach for PTSD is we can treat some of the symptoms, but we don't have any medication that globally treats the broad range of intrusive, reacting, reactivating, avoidance symptoms that are associated with PTSD. The standard psychotherapy approaches have been largely exposure-based or sort of cognitive behavior-based, and those involve sort of reliving the trauma, rethinking the trauma, going over and over it again until you reprocess it in a different way. And although those therapies do work, we have a number of studies showing they work, they're not just difficult to do, they're actually aversive to do, because they're asking someone to go back into an event that is particularly traumatic or repugnant to them and to immerse themselves in it. So although we have techniques that work, many people refuse to participate in them, or they're too difficult at the beginning stages for them to continue. So again, this consortium of VA centers developed this, what they call mantram therapy. So in simple 8 one-hour sessions, they taught people how to use a mantra. They also focused on some slowing down of your thinking techniques and some what's called one-point attention, where you focus on just one thing at a time. And they compared that to what's called present-centered therapy. And present-centered therapy, we know is effective against PTSD. Numerous studies. It involves a problem-solving approach and looking at current stressors in the person's life. So this wasn't a mantra therapy versus no treatment approach. This is a mantra therapy versus what's called present-centered therapy. And after a few months of treatment, about 60% of the people in the mantra therapy had marked improvement of their PTSD symptoms versus about 40% in the present-centered therapy treatment, when that was a significant improvement. There were some other measures where the two groups were the same, but again, given that this was an active comparison group compared to an effective therapy, this is pretty darn good evidence that this is a good and helpful approach for PTSD. My contention, and this is speculation based on what I've seen clinically and a little bit of what I know sort of neuroscientifically, is that this is an approach that should probably work for a broader range of panic symptoms. And I've been using it with some of my patients and treating panic attacks, for treating social anxiety, and a broader range of anxiety or issues. Now, one of the hallmarks of anxiety is that someone is out of the flow of whatever they're doing or working on, and they're in a state, and this is particularly easiest to see with social anxiety, where instead of doing the task, they are focused on how well they're doing the task, and often imagining how others are seeing them doing the task. Their focus is off. They're not doing what they want to do. They are using their mind to evaluate, to think, to get out of the flow, get out of the zone of doing, of evaluating. And with anxiety, it's always negative evaluations of what's going wrong or what's imperfect or what's looks stupid, foolish, ugly, whatever. So, and the other things we know about both depressive and anxiety states is that for years, probably 50 years, psychiatry and mental health is largely focused on a biochemical approach. So we've thrown serotonin agents and messed with dopamine and norepinephrine, and more recently a few other neurochemical agents in an attempt to help with depression, help with anxiety. Certainly serotonin reuptake inhibitors work quite well for a range of anxiety symptoms. They don't work quickly. We do have benzodiazepine-based, so those are the Valium, Klonopin, Xanax-like drugs that also work for some anxiety symptoms, and they work quickly and seem to be affecting the GABA system in the brain. More and more, we're moving away from a purely neurochemical way of looking at things, and not that that's wrong or unhelpful. It's just that it's a limited approach and looking more at brain networks. One of the things that's been pretty consistently replicated is that both anxiety disorders and depressive disorders seem to involve overactivation of what's called the default network. The default network sounds like a strange name for a network, and got its name from the early days of brain imaging studies, where they would tell people to engage in a certain activity when they were in that functional MRI scanner. And as a control, they would tell the person to sort of relax, think of nothing. And that was considered sort of a neutral control, but the brain is not ever doing nothing. It's doing some kind of nothing. And the some kind of nothing that got labeled the default network is where people are in a sort of distracted, meandering, inward turning, introspective jumble of thoughts. So again, this is not a quiet, still, nothing mind. It's a distracted, overactive, internalized way of thoughts. And again, the research suggests people who are prone to anxiety and depression have that default system wired extra strongly compared to non-depressive, non-anxiety individuals. And when they're in active anxiety ruminations, depressive ruminations, strong activation of the default network is occurring. So there's a little bit of research, or science, looking at the brain research, that when you instruct people to chant a mantra when they're in these functional MRI or other scanners, even novice practitioners, so people who don't have an elaborate meditation practice, haven't extensively used mantras, but teaching or telling someone to just chant a phrase over and over again suppresses that default network. So again, instead of having random scattered, inwardly evaluating thoughts, the mind moves to a different, or out of that network. And studies so far also have shown that the more you practice the mantras, the more you're effective at deactivating, suppressing that default network. Some of that, meshes well with studies that have been going on since the 70s. Again, Herb Benson at Harvard-related hospitals, and he's written a book long ago with many reprints and new editions called The Relaxation Response, showing that part of what the meditation practices do is to activate parasympathetic nervous systems to get into a different state in both your body and in your brain. Some of the work he had done earlier was showing that this relaxation response was evoked in terms of mantras when people were either repeating some of the Sanskrit phrases like Om that are traditional Hindi mantras, or if they were reciting English words. So the magic of using mantras is not specific to using Sanskrit words or phrases. So if you already have an existing practice, if you're already chanting, your namastes and Oms in other language, in Sanskrit or other languages, or if you already have a Arabic Muslim tradition of chanting or meditation, or a Hebraic prayers, or you have your own religious system, I'd say, great, I would practice that and keep using that. But again, English is certainly effective and useful. And when you choose your mantra, part of it is to choose it with intentionality. And if we're using it to deal with or address panic attacks, you want to choose words that are simple, declarative, and remind you that you will get through this, that the current stress, the current horrible situation that's turning you into a panicked, frazzled individual is a short-term event, that you will get through it, you will get over it, you will get around it, you will survive. The mantra should make sense to you. It should appeal to you. It should sound good. So even if the concept is good, but the wording sounds cacophonous or disruptive, you're less likely to practice it. It's less likely to be helpful or effective. So certainly practice is an important part of this. And often when I present mantras or talk about them, people start feeling, I'm going to feel self-conscious if I say this. Not a lot of research, but a little research suggests that it doesn't matter terribly whether you are saying these out loud, whether you are whispering them under your breath, or whether you are reciting them silently to themselves. All these forms of using a mantra can be effective in this day and age when everyone's on their earbuds and cell phones. Everyone's talking to themselves, so you don't need to worry about that one anyway. So getting back to intentionality, some of these, many people might call them more affirmations than mantras. I'm not going to quibble over that point. You can certainly have affirmative mantras. The ones I am using are specifically secular. Again, if you have a religious tradition that makes sense to you, great, tap into that. Children of my era and even eras before and after were taught the story of the little engine that could. I think I can, I think I can, I think I can. And at some level, our parents were teaching that I think I can as a mantra. I think I can incorporates the possibility of, well, maybe you can. And you want a mantra that's more affirmative, more certain that you'll get through it. Because exactly what's hard to hold on to when you're in the midst of a panic attack or feeling anxiety is that you will get through it. You're using the state to counteract that, to work against it. So one other level, we do have a number of cognitive behavioral therapy techniques for talking back to panic attacks, for using your rational mind to calm yourself. We have breathing techniques. Problem with some of them is that one of the things that goes on in a panic attack is we know that blood is preferentially shunted away from some of your cognitive higher processing centers. So it literally is harder to think when you're in a panic state. The mantra approach, if it's practiced enough, it is more a sort of a subconscious, you practice it to the extent that it just flows from you and you don't have to rely on your ability to sort of claw back to higher cognition to use the tool to get you into a cognitive state. It can be more accessible when you are less able to access higher thinking if you have it over practiced. So again, some of the mantras I've suggested, one of the more traditional ones is I am peace. Many of the ones I've chosen are a little more self-affirming instead of neutral. So I am brave. That's one taught to me by one of my patients who, when I was teaching her this approach as an adult, she remembered when she witnessed horrible abuse in our family growing up, that she would just tell herself over and over again, I am brave, I am brave, I am brave. And that put her in a state where she was able to get through things in the moment. So I think that's a good one. A little more sort of bro-ish jock guy one is, I've got this. I think that's a good, powerful, assertive one. I mean, it tells you bad things may be going on, but I've got this. I will get through. I did have someone who was using that, and they decided that in the time of COVID, I've got this. Maybe it wasn't the best mantra to be using there. For those of you who are Helen Reddy fans or 60s feminists or beyond to Ruth Bader Ginsburg, Helen Reddy's song, I Am Woman, I Am Strong, or I Am Invincible. One of my favorites is from the disco era. Gloria Gaynor's song, I Will Survive. That's pretty much sums it up. I will get through whatever is going on right now. I will get through this. I also have someone who's using mantras specifically to help them get to sleep. And as we've talked in the sleep episodes, anxiety arousal states are the enemy of sleep. So their sleep mantra is, I will return to sleep. And I'm saying it in sort of a sing-song voice because most of the mantras I just said are either sort of 3-point bang, 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 I am brave, I am peace, where they're using an iambic, not necessarily pentameter, but the iambic rhythm, da-da, 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 da-da. And some linguists have theorized that the iambic meter is in tune with our heart rate, and maybe the iambic pentameter, being 5 feet of that, 10 syllables, may help coordinate both breathing and heart rate together. I tried to find research on that. I didn't find a lot of rigorous research. You that aren't sort of affirmative, starting with the I phrase, this too shall pass, is a pretty good mantra. Time heals all wounds is another good mantra. It's allowing a little more pain and negativity in. So again, the important thing is to practice. And again, with this treating full-blown PTSD, as little as 8 one-hour episodes of practicing the mantra and some other meditative approaches had a marked effect. Again, some of the studies by Benson and others show that mantra chanting, even in a few minutes, does disrupt the overactive default network and brings in parasympathetic activation. So the more you practice, the better. But even within a few minutes, this is likely to be helpful, and try to get through the first few seconds or minutes where you may be more in that default network, evaluating, criticizing mode. That would be an initial barrier to getting into this. So I'm not seeing any questions. I'm going to switch to Gloria Gaynor as I fade out what I think is one of the best mantras, I Will Survive.